Hi, everyone. I'm Ellen Madison Griffiths, registered dietitian nutritionist, here to share some serious, but I believe helpful information on the topic nutrition matters in a COVID-19 era, an ounce of prevention. I've been a nutritionist for many years, but I have to say I've never felt any stronger about sharing prevention information than I feel today. Just like you, I want to see us emerge from this pandemic and soon. So what I want to do is to give you some tips to keep all of us healthier. I'll be talking about 4 different nutrients, and all of them should help to make you feel stronger and also help to make you resist the COVID-19 virus. So let's get started. This slide presentation is for informational purposes only and is not intended to be direct medical care. Please seek the advice of your medical professional. The first nutrient I'm going to talk about is vitamin D. Usually when we hear about vitamin D, it has to do with bone health, bone growth, bone mineralization, bone repair. But vitamin D has a number of functions, and one of them is immune function. And what I mean by that is our body's ability to fight off bacteria and viruses that attempt to invade it. We continue to learn about vitamin D, but even before the COVID-19 era, we knew that about half the US population might be deficient in vitamin D. Some of you may have even gotten prescription strength vitamin D from your providers. Others of you may be wondering what happens when you're low in vitamin D. So the symptoms would be you're feeling tired, or you might have hair loss, or you might have slow wound healing. Say you have a scratch or a scar that's taken a longer than usual time to heal. You might catch colds easily, or have stomach troubles like constipation or diarrhea. You might have muscle pain, and all of these symptoms would be occurring with no other known cause. So what are some food sources? Because actually vitamin D is known to not have a lot of good food sources. So let's identify the ones that we know about. Some fish like salmon, rainbow trout, mackerel, and tuna are good sources. Egg yolks are a pretty good source. And then there are fortified foods. That means foods that have had the vitamin D added. It did not naturally occur in them. And those kinds of foods include cow's milk and the plant-based milks like soy milk and almond milk, but also breakfast cereals, breads, mushroom, and some orange juices. If the orange juice has vitamin D added, you will see it labeled very prominently on the food. Now, I want you to know a little bit about nutrition facts so you'll be able to figure out how much you're getting from the different nutrients we're going to talk about. The upper 1/3 to 1/2 of this nutrition facts label that's located on the right side of the slide is for large nutrients. The nutrients I'm talking about today are the ones that would be smaller, micronutrients, and they'll be located on the bottom 2/3 to 1/2 to 2/3 of the label. So vitamin D is listed here. It's in the middle column of these different vitamins and minerals, and it is the second one. It's right under vitamin C, 120% of the daily value. All right, how much do you need? If you're thinking you're allergic to seafood and maybe you don't particularly like the foods that I mentioned that are fortified, you might want to know how much you need. So the recommended dietary allowance for people 19 to 70 is 15 micrograms. For people over 70, it's 20 micrograms. So if you're thinking that you might have some of those symptoms and you might want to take a supplement, my suggestion to you is first consult your primary care provider. Sometimes supplements, even though they seem very innocent, might interfere with your absorption of different medications. You might have to watch the timing of them, or they might not be compatible. So please don't go out on your own without keeping your primary care provider in the loop. Let them know that you're considering it. Also, let them know that you think that you've got some of these deficiency symptoms that I just mentioned and that are listed here. That's my main advice. Let's move on to the second nutrient. It's vitamin C. Vitamin C is something that was marketed heavily to some of us baby boomers. That's because the orange juice manufacturers let us know that you need vitamin C every day. The body doesn't store it. And orange juice was a very good source of vitamin C. It's not the only good source of vitamin C, but we sort of got that idea. Another item about vitamin C that was controversial from the baby boom era, from our youth, is that vitamin C was thought to have a role in preventing or treating the common cold. So why am I talking about this? Well, the common cold is caused by a virus. So let's continue finding out about what vitamin C can do. Most of the scientists in this controversy used to weigh in on, oh, it's not going to make a bit of difference. You're going to have this cold for 7 days, whether you treat it with anything or not. But then in 2017, the NIH, the National Institutes of Health, released the findings of a study that said that vitamin C appears to prevent and treat respiratory and systemic infections. So the virus that causes the common cold would be a respiratory and systemic infection, but COVID-19 is also. So that's why I'm mentioning it. So what happens when you're low in vitamin C? Let's look at the deficiency symptoms: tiredness, weakness, loss of appetite. How about easy bruising? That's a little bit different. Bruising of your skin, swelling, bleeding, discoloration of your gums, also tooth loss. And then, as we saw with vitamin D deficiency, poor wound healing, where the healing is happening slower than you're commonly experiencing healing from scars and scratches. Let's look at the food sources now. All right, I didn't list orange juice, but actually orange juice is a good source, as well as oranges and all citrus fruits. Less well known are red and green peppers, strawberries, broccoli, cantaloupe, cabbage, spinach, and leafy greens. All of those can be good sources of vitamin C. What's the recommended dietary allowance? Well, for women, it's 75 milligrams, and for men, it's 90 milligrams. Vitamin C is still not without its controversy. Dr. Anthony Fauci, who heads up President Biden's COVID-19 task force, was asked about vitamin C as a way to prevent COVID-19. And this was back in September of 2020. And he's known to have said 1,000 milligrams up to 2,000 milligrams might be a good amount to take to prevent vitamin or COVID-19. What I want to do is refer you back to your primary care provider or a dietitian if you have one to give you some advice. The reason I'm saying your primary care provider first and foremost is because they're the ones prescribing the medications that you may be taking, and they're monitoring you. They're the person that is in charge of your health and helping you to be the healthiest you can be. So keep that in mind, but that may be a question you want to ask. You may be able to contact your doctor's office, or if you're due for a visit, even though it's COVID-19, you don't want to necessarily miss out going to the primary care doctor for your physicals and regular checkups. It's been a year. Let's go to the third nutrient I'm talking about today, and that's magnesium. Magnesium is a mineral. Magnesium has a role not only in immune function, which is why I'm discussing it, but also in blood sugar regulation, blood pressure regulation, and heart rhythm, among other functions that it has. Even before COVID-19, we knew that half the US adults don't consume enough magnesium, and that came from dietary studies. But the second point on the slide here is something I want you to let sink in. It is common for COVID-19 patients to have low magnesium levels. So if it's common for people who are where we don't necessarily want to be as COVID-19 patients to have something, there's a possibility that if you have normal levels of magnesium, you might not have COVID-19. So we don't know it. There's a possibility of an association, but we want to pay attention. We don't want to be low in any nutrient that we could easily correct by having a healthy diet. So what happens when you don't have enough magnesium? How would you know? Maybe you have a loss of appetite, or you experience nausea and vomiting, or fatigue and weakness. But unique to magnesium, of the nutrients we're talking about, is numbness and tingling, maybe in your hands and feet, or maybe muscle contractions and cramps, or maybe even personality changes, or maybe abnormal heart rhythm. So those are some things to pay attention to. What are some good food sources? Almonds, spinach and leafy greens, peanuts, soy milk and plant-based milks, black beans, potatoes, brown rice. Now, if you want to know how much you should be getting, and you want to be able to look at labels and have be able to make an informed decision, the recommended dietary allowance for women is 320 milligrams, and for men, 420 milligrams. Again, check with your primary care provider. You don't want to get too little or too much. The fourth nutrient I'm going to talk about is vitamin E. Vitamin E fights invading bacteria and viruses like COVID-19. That's the kind of information we're looking for. It has a role in widening blood vessels and keeping blood from clotting within them. Now, how would you know if you're too low? It's rare for people to be low in vitamin E. The deficiency is rare unless people have trouble absorbing fat. Conditions like Crohn's disease and cystic fibrosis would be the kind of conditions where you might have some trouble absorbing fat, but there are others. Let's think about the food sources, though. I am guessing that the reason we don't have much vitamin E deficiency is because vegetable oils are a very good source, in particular sunflower and safflower oils, and those are often included in what we purchase as vegetable oil. But other good sources are almonds and peanuts and sunflower seeds, spinach and leafy greens, broccoli, oatmeal, bananas, and salmon. And that covers a lot of food groups and some pretty tasty foods, so maybe that's part of the reason. But if you want to know, to be an informed consumer, 15 milligrams is a recommended dietary allowance for men and women. So in summary, let's look at the vitamins and minerals that I talked about. What I've done is listed the good sources that I mentioned and put them in a table. So I highlighted the ones that are a good source of more than one nutrient. So salmon is a good source of vitamin D and vitamin E. And broccoli is a good source of vitamin C and vitamin E. Spinach and leafy greens are a good source of vitamin C, magnesium, and vitamin E. Almonds and peanuts are a good source of magnesium and vitamin E. Now, these foods could be the beginning of a short grocery list, and they don't have to necessarily be very expensive. Fresh salmon would be preferred, but canned salmon is a little less expensive, so you might want to think about having them. Frozen vegetables could be a source, like broccoli, spinach, and leafy greens, and they cost a little bit less than the fresh. And farmers markets will be opening in April if all goes as planned. And if you go to the farmers market near the end of the selling day, you risk not being able to find the food. But the farmers don't usually want to take the foods back to their farms, so you might get a pretty good deal. Almonds and peanuts sometimes are hard for some people to chew. And of course, some people have allergies to them. But if peanuts are difficult to chew, you might think about getting peanut butter or even almond butter. In summary, vitamins D, C, E, and magnesium are important to prevent infections from bacteria and viruses. COVID-19 is caused by a virus. Foods are a desirable source of nutrients. Check with your primary care provider before adding supplements to your intake to inform them and to avoid any possible interactions. Check with your local pharmacist if you have questions, and dietitians can also advise you. Stay safe and be well. But before you go, I'd like to ask that you please complete the Zeta Omega chapter Facebook page survey. This is the link, and thank you.